Hello and Minglaba. Happy Myanmar New Year, everyone. Welcome to MI Radio's Myanmar Today. I'm Henry Zin. Thingyan Water Festival is over, and the last day of this year's Thingyan, how does it compare to last year? We'll find out more later. Special rescue teams set up to focus on relief measures against COVID-19. And as we well knew, public transport will run normally during Thingyan holidays. That report is coming up in a while too. And a story coverage on 400 trishaw drivers in South Okkalapa receiving aid. All of that on this edition of Myanmar Today, but for now let's take a look at what's happening in local news. President of the Republic of the Union of Myanmar, U Win Myint, sent a message of greetings for Myanmar New Year. The president said in his message he, quote, wishes for good health and peace of mind on the occasion of the new year to all esteemed citizens of Myanmar, and said that he's, quote, deeply saddened by the fact that because of COVID-19 global pandemic during this year's Thingyan, and all of us could not move freely and have fun. The president said he wishes, quote, to extend his deepest gratitude to the staff implementing protection, containment and treatment procedures concerning COVID-19, the donors and civil society organizations helping out, the professionals, experts and members of the media for their assistance, and to all the citizens for closely following the directives and regulations issued during this period. President Win Myint added by saying, quote, I urge all of you to cooperate and participate to solve this problem by combating this global pandemic in unity as a national duty as everyone has a responsibility. State Councillor Aung San Suu Kyi wrote on her Facebook page Thursday that the requirements for prevention, containment and treatment of COVID-19 have now become clearer and more precise, and that with regard to COVID-19, interventions will begin with legal actions. The most important thing is the need for all to understand the prevailing situation clearly. The State Councillor wrote, quote, regarding COVID-19, we will begin our intervention with legal actions. We will issue a statement outlining what legal action will be taken according to what law on which person for what offence. This is to ensure that it will be fair, correct and the same for everyone. Notifications and statements of the Ministry of Health and Sports will be announced in wards and villages 5 times daily. I want all of you to listen carefully and follow these instructions. The State Councillor also wrote, quote, another important matter relates to quarantine. Some people are really scared of quarantine. The reason for putting people under quarantine is to ensure that others, including family members, are not infected. It is also to make sure that once symptoms of the virus are detected, treatment can be given promptly. Just think about this. How horrible it would be if the COVID-19 virus is carried by the infected person who runs away from quarantine. And she continued the message by saying, quote, we will be implementing programs in the coming days to give recognition and practical support to the frontline health workers and quarantine volunteers who constitute a very important source of strength for all of us today. The Ministry of Health and Sports has issued the following order under the authority of Article 21B of the Prevention and Control of Communicable Diseases Law. The Ministry of Health and Sports has categorized the coronavirus disease as a disease of swift spread, or the case to be reported with the order number 19/2020 on 28th of February 2020. The public must abide by orders and instructions of the Ministry of Health and Sports and the Public Health Department regarding prevention, containment measures against the COVID-19. 5 or more than 5 persons are prohibited from gathering, except for the following reasons, in a bid to contain the spread of COVID-19. Going to and returning from office duties at the state, departments or organizations. Going to and returning from the workplace for duties at the companies, factories and workshops. Buying and selling at permitted markets and shopping malls. Transports of permitted commodities. Court proceedings. Permitted measures against COVID-19, emergency rescues and emergency cases, going to the hospital and clinic for health issues, and funeral affairs. Actions will be taken against those breaching the orders and instructions of the Ministry of Health and Sports and the Public Health Department regarding the COVID-19 under the Prevention and Control of Communicable Diseases Law. That's all for the local news. Let's take a look at the first report now. On the last day of Thingyan, or as we call it here in Myanmar, The Jan Atenni of Thingyan Festival has been confirmed to be a really silent festival for this year. Myanmar people have never experienced such events and circumstances in their lives for decades or even centuries yet. Thingyan Festival has been such a joyous water splashing festival decorated by the smile of the people and the seasonal flower, Badao. Let's find out more about how this year's Thingyan Festival compares to last year's with our reporter, David Tanner.
Thingyan is the Myanmar New Year festival that usually occurs in the middle of April. Water throwing one another from any device that delivers water is the distinguishing features of this festival. But unfortunately, on this year of the Thingyan Festival, the overall celebrating of Thingyan Festival and crowded events are prohibited until the end of April 2020 for a threat imposed by globally terrifying COVID-19. With that being said, we will find out more about the circumstances of Thingyan occasion and how it compares to the 2018 and 2019's Thingyan situation from Professor Dr. Momo U of Emergency Department of Yangon General Hospital, YGH.
As the Thingyan Festival has been cancelled across the country, there have been almost 0 cases related to Thingyan Festival. Even though there are minor cases like car accidents and other general emergency cases, during this period, it is not actually connected to Thingyan. If we are to compare this situation to last year, it will be like this. In 2018, during Thingyan Festival, there were 843 accidents happened due to different reasons, and 18 cases were brought dead. In 2019, the accident rate rose to 914 in number, but the cases of being brought dead decreased to 6. So we can say it's a positive thing to have no emergency cases relating to this year Thingyan Festival. But on the other hand, it is unfortunate for us and the whole country on account of the COVID-19 outbreak happening at this time of period. With that said, I can confirm that we are currently handling and giving emergency treatment and checking up on almost 40 suspected patients with the symptom of sickness and shortness of breath every day.
On the last day, or as we call that day of Thingyan Festival, it has been confirmed to be a really silent festival for this time of the year. Myanmar people have never experienced these kinds of circumstances in their life for decades or even centuries yet. Thingyan Festival has been such a joyous water-throwing festival decorated and scented water sprinkled from the silver bowl. With that said, let's find out the current circumstances around some parts of country. This time will be the Molamyan of Moon State, which is renowned for its major Thingyan celebrations across the state, usually in this time of the year. But what kind of serious big changes has this year's Thingyan Festival celebration happened there? For that, we will hear out from one of the locals of Molamyan, Ma Kai Shui U.
Usually, Thingyan is celebrated in 2 parts here. The first 2 days, which are Ajo and Aja, will be named as Children's Thingyan, which children celebrate the festival, while the last 2 to 3 days, depending on calendar, Aja, and the last day of Thingyan, Ada, will be celebrated joyously by the adults. Typically, the last day of the Thingyan is also known as Chaimayor Thingyan, in which we people go and gather at Chaimayor Pagoda and feel the experience of the authentic Molamyan Thingyan. But this year, Thingyan has been such a quiet, silent and tranquil experience with no such kinds of celebrations across Molamyan too. But I hope we could celebrate a lot more next year.
Utundun U, chairman of Yangon Rescue Organization, also updated MI Radio on how the rescue measures they are going to take have dramatically changed in their situations and places when compared to those of last year. Let's find out.
Last year,
Thingyan, we have provided rescue measures in crowded places like Inya Gambong and other major lanes and streets where there might be prone to accidental issues. But this year, we are only taking the preventive measures and only providing relief work on emergency cases relating to COVID-19. With that said, I am really glad most of the people in Myanmar are following the guidelines of social distancing and other preventive measures that our Ministry of Health and Sports released.
Reporter David Tanner reporting from Myanmar International Radio.
That's a report on the last day of this year's Thingyan and how it compares to last year. All right, we'll carry on with the next report. The special rescue team, with many preparations from different sites, is likely to continue until the WHO announces that COVID-19 is overcome. The team has 15 private ambulances and 7 vehicles to carry the dead body affected by COVID-19, and preparations have been well made for the entire Yangon region. The opening ceremony was held on 9th of April at the school camp of the special team. Here's a report.
A special rescue team has been set up by the Yangon Rescues organization with the purpose of mainly focus on relief efforts in domestic COVID-19. The special team has been camped at number 2 Basic Education High School, Tamwe in Yangon. Unlike the other rescue teams for COVID-19, the 25-member special rescue team was organized with advanced protection for possible infection conditions of the rescuers. The reserve crew for special team has been also prepared not to lose the manpower at a time when the special team members has been put into a 14-day quarantine while operating. The team has 15 private ambulances and 7 vehicles to carry the dead body affected by COVID-19, and preparations has been well made for the whole Yangon region. The opening ceremony was held on 9 April at the school camp of the special team. Speaking to Myanmar Radio about his opinion on the formation of the special rescue team, Udo Wen, Local Representative, Tamwe Township said,
COVID-19 is a battle not with the armed struggle, but for the unity of the public.
The special rescue team with many preparations from different sites is likely to continue until the WHO announced that COVID-19 is overcome. Those who belong to the team are allowed with the parental permission and the same permissions from their spouse. U Tun U, who is the chairman of Yangon Rescues organization, speaking to Myanmar Radio about the special teams, how to carry out their relief work in the emergency situation, he said,
The
Yangon Rescue Organization was formed about 2 years ago. The team has been specially organized only for COVID-19 currently. The special teams are placed with its private dorms, which can accommodate 12 people each. The second group is also prepared if the first group is put into a 14-day quarantine. The team is designed for emergency response to special conditions to carry out rescue work. The number 4 BHS is designated to be used for community-based facility quarantine center in Damwe. We separate the quarantine centers and special team camp because the teams have to perform social rescues and we have to prevent the public from the spread of infection. The team is comprised of doctors, nurses, and also the volunteers. But there are some requirements, including PPE suits and preparations are underway with the support of donors.
Speaking to Myanmar Radio about the needs for the qualifying PPE suits and pesticide, Don Nai Winte, the secretary of Htin charity group, said,
Here are only just over 50 qualified PPE suits. The rest are used while spraying pesticides. The market saw a shortage of pesticides. The government said that they will provide for. Currently, the regional health center provided hundreds of PPE suits. The standardized PPEs, N95 masks, and other safety accessories are needed for the volunteers' safety. A full quality suit costs about 40,000 jets. When an ambulance goes out, it takes about 3 people. So if we are to leave, the cost is over 100,000 jets. There are 137 teams with more than 3,500 volunteers and over 400 ambulances to carry out rescue efforts in Yangon region.
The special teams has been set up and they are ready to extend their support if necessary. Go Nguyen So, who is the team leader of the special rescue team, spoke to Myanmar Radio about their determination to serve the interest of the public. He said,
We are social rescue teams and we don't have strength to refuse, and we can. As we prepare to serve the public, we also have to prepare for our own safety, and the government also supports us. There are no worries about the infection, that we are systematically clean with proper pesticides whenever one ambulance comes back. Just before the formation of the special team, we have discussed with our teammates. If something is happening to me, the rest teammates will have to keep it going and don't feel sad. I have already told my family that we are serving the interests of the public and don't be so sad, and to stay and keep on their life path. We came to the special rescue team just only for the public.
That's a report on the special rescue team setting up to focus on relief measures against COVID-19. Stay with us as we bring you more reports on Myanmar Today. According to the Yangon Region Transport Authority, for the convenience of the public, more than 1,000 buses in 56 routes are running from 12th to the 16th of April, the Thingyan period. The 226 routes of highway buses at Amingla Highway Gate ran till the 9th of April.
Myanmar is alive with its special water festival, Thingyan, expert in the wake of COVID-19. The government has prohibited public gatherings until 30th April. According to Yangon Region Transport Authority, YRTA, for the sake of the convenience of the public, more than 1,000 buses in 56 routes are running from 12th to the 16th April, which is Thingyan period. U La Ao, Joint Secretary of Yangon Region Transport Authority, said,
For the sake of convenience and safety for the public in transportation, we are trying as much as we can. We hope the public will cooperate in this process and follow the suggestion educated by the Ministry of Health and Sports while traveling. The YRTA is operating with the Ministry of Health and Sports before the confirmed case of COVID-19 in Myanmar, and we are watching and handling the entire possible situation in public transportation. We are raising the public awareness through audiovisual display, brochures and posters on the buses and bus stops, as well as the station with the instructions of Ministry of Health and Sports. We will directly inform if we find out doubtful case. Just after the announcement of COVID-19 as a pandemic disease, we are restricting the cleansing process of city buses and highway buses. We have instructed to use alcohol in cleansing all the space where the public is exposing. We are giving the hand sanitizer, mask and tissue to the passengers on the buses as much as we can. We have postponed all the public gatherings in aspect of YRTA, including the registration for city taxi until the end of April.
Annually, more than 215,000 passengers pass through 3 highway bus terminals, Amingla, Dagong Eya, Dala for Htin holidays. The 226 routes of highway buses at Amingla Highway Bus Terminal ran till 9 April, but only 11 routes are running, and the rest of the routes are running alternatively till the end of Thingyan period. U Nemyo, officer of Sri Sin Sajar Express, said,
About 30 highway buses from our Shusin sector Express Yangon are running. All the tickets till 11 April are sold out. Even in the wake of COVID-19, the passengers still keep going on. Every year, we sell the ticket for the seat starting early March. We also sell the ticket for the seat during Thingyan holidays. So we will run our highway buses till the government announce the updated news. All we can say is that We will follow as exactly as the government instructed. We have cleaned the buses using alcohol before the passenger get on and also as soon as the destination ends. Here many passengers are going through. We can afford to share the hand sanitizer and masks to all the passengers. So we made the hand wash basin so that the passenger can clean their wash also.
A passenger named Koye said,
I have to return to Myitkyina as I know that some offices closed earlier than the period of holidays because of COVID-19. I'm trying to buy the tickets earlier than previous years, but there is no ticket for the right bus line from Yangon to Myitkyina. Now I am taking the buses to Shwebo and transit to Myitkyina by train. Some of my friends find difficulties as there are no tickets for seat until 11 April. The passengers have to take care themselves if they don't want to be transmitters of the virus to their family. We have to do the personal care as much as we can. We can rely only on the government at all.
I am Jyoti Ritu. This is news reporting from MI Radio.
Well, let's move on to the last report before we go to international news. COVID-19 outbreak brings a significant impact on the socio-economic development of the country. Hardest hit are the people from the grassroots level. Therefore, well-wishers and the government are in a bid to ease the pressure on the majority of the population. Recently, 400 trishaw drivers in South Okkalapa received aid from a charity organization. Let's hear more about their struggle amid the pandemic outbreak.
As the infection of COVID-19 pandemic is accelerating in the world, confirmed cases of COVID-19 have exceeded 1.4 million globally, with the death toll surpassing 81,000, according to Johns Hopkins University. Until 8th April, Myanmar has had the 22 confirmed cases since the first cases reported on 23rd March. Now the government has imposed additional restriction on the residents' movement during the coming Thingyan period. This travel and commute restriction triggers big concern, especially amongst the working class people living on mouth-to-hand existence. Therefore, charity organizations and the government are in a bid to assist the worried working class population. On 7th April, about 400 trishaw drivers from South Okkalapa flocked to the place where they received rice, oil, and masks from a charity organization. The organizer, Uzonai, explained the purpose behind the charity activity.
One day I was walking down the street and I gave a friendly smile at a trishaw driver and he smiled back. But the smile is not a happy one, but on his face full of tiredness. Then our group conducted a research on these current socio-economic lives and found that their income dropped significantly due to the pandemic's impact. Worse still, their family members lost jobs, and so we put together this charity event to assist their needs.
The donation for the trishaw drivers included items such as rice, edible oil, pepper, and onion. The well-wishers' donation not only comes in cash, but also in the form of basic foodstuff. Reusable masks were provided, and the trishaws were sprayed with disinfectants. Dr. Pye Pyolwin, one of the donors, said,
When the trishaw drivers enter the campus, we will have them wash their hands and we will spray disinfection to their trishaws. Will be sprayed on the trishaws beside the people. After washing hands and spraying disinfectants, we will give them the mask and we will continue to collect rice, oil, and foodstuffs. We will also ensure that each trishaw is 3 feet apart.
The Myanmar government has recently rolled out its plan to provide rations to the people in need. The first 150 units of electricity for free and reached agreement with the internet service providers to promote the habit of staying indoors. U Do Win, one of the trishaw drivers from South Okkalapa Township, said,
I am very glad with the aid we received when we are in need. Food is a challenge at this time with the pandemic happening. That's the biggest challenge, and we are having a hard time to have a living. The whole day work leaves us with 2,000, 3,000 kyats, and that is not enough for the whole family.
Before the pandemic hits the country, the daily income of the trishaw drivers stood at an average 8,000 kyats. With fewer people going out to commute, their income was cut down to one-third of their usual earnings. Trishaw drivers are just one part of the grassroots suffering from the impact. Gozia, another trishaw driver from South Okkalapa Township, explained.
Before, I would make 10,000 just or over daily, and now we are struggling to earn even a couple thousand just. So I could not feed my family properly. Now with this ration provided, we will be good for a certain period of time.
Confirmed cases of COVID-19 have exceeded 1.4 million globally, with the death toll surpassing 81,000, according to Johns Hopkins University. The Chinese mainland's total number of cases has reached over 81,000, including 1,042 cases that have come from abroad. A total of 1,095 asymptomatic patients are under medical observation. The death toll in China stands at over 3,000. The US has over 390,000 COVID-19 infections so far, and the death toll has exceeded 12,000. This is Agajo reporting for Myanmar International Radio.
And that's all we have for today's reports. Let's check on some international news now. US President Donald Trump halted funding to the World Health Organization on Wednesday, claiming it has, quote, failed in its basic duty in response to the coronavirus outbreak. Richard Houghton, the editor-in-chief of The Lancet, said Wednesday on Twitter that Trump's decision is a, quote, crime against humanity. Bill Gates also tweeted, quote, this decision is as dangerous as it sounds.
Today, I'm instructing my administration to halt funding of the World Health Organization.
President Trump's decision to defund WHO is simply this: a crime against humanity. Every scientist, every health worker, every citizen must resist and rebel against this appalling betrayal of global solidarity.
The focus of all political parties should be to save their people. Please don't politicize this virus.
In other news, China has rejected accusations from the US State Department that it has violated its international obligations by secretly testing nuclear weapons. At a press conference on Thursday, a foreign ministry spokesman said Washington's report was, quote, made of thin air, totally unfounded and not worth refuting. He added the international community should be wary of the United States, which was continuously adding to its armed forces in a manner that undermined the global strategic balance. Japanese Prime Minister Shinzo Abe on Thursday declared a state of emergency for the whole country until 6th of May over concerns surrounding COVID-19. Abe told a special meeting of medical experts called to discuss the disease, quote, areas where a state of emergency should be carried out will be expanded from the 7 prefectures to all prefectures. On April 7th, Japan declared a month-long state of emergency in 7 of its 47 prefectures, including Tokyo and Osaka. Under a revised law enacted last month, the emergency declaration will empower governors to roll out restrictive measures, such as calling for the closure of schools and non-essential businesses. Japan has so far confirmed more than 9,000 cases of COVID-19. From January 3rd, when China began to inform the US of the pneumonia outbreak, to almost 10 weeks later on March 13th, when Trump finally woke up and declared a national emergency. There was a lot that could have been done. The question is, what has the White House done? Take a look at the video for more.
1月3日，中方开始定期向美方通报疫情信息和防控举措。
目前的这个资料表示呢，它是肯定的有人传人。
At least 6 people have died in an outbreak of the new coronavirus, which has now reached the United States. The Centers for Disease Control and Prevention has confirmed the first U.S. case has been detected in Washington state.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
People die from the flu. We have 12 cases, 11 cases. Typically that will go away in April. We're in great shape though.
This disease, as Dr. Shukat said, is contained.
It's going to disappear. One day it's like a miracle. It will disappear. Democrats will only say horrible things. So far, we have lost nobody to coronavirus in the United States. Our country is doing so great. We are so unified.
WHO, the assessment that COVID-19 can be characterized as a pandemic.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. The CDC is advising the use of non-medical cloth face covering. I don't think I'm going to be doing it.
$16,000 deaths in New York. That means you're going to have tens of thousands of deaths outside of New York.
You know, I would say between 100 and 200,000 cases, but I don't want to be held to that.
We could hold that down, as we're saying, to 100,000. We all together have done a very good job.
The Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, has said to not politicize the COVID-19 virus, and the voice of the WHO can be heard all over the world. Take a listen.
Of a previously unknown pathogen, which has escalated into an unprecedented outbreak and which has been met by an unprecedented global stocks of masks and respirators are now insufficient to meet the needs of WHO and our partners. It is COVID-19. This is your window of opportunity. So my advice to these countries is to move swiftly and contain it at its birth. And we have now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level.
The time is to act now. The time is to act early. The time is
Even the high-income countries should expect surprises. The solution is aggressive preparedness. WHO has been assessing this outbreak around the clock. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Whether we like it or not, we have to learn to live with globalization, make sure that we act in unison to build the global preparedness and the global resistance.
Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. And I wish all of you to be healthy, happy, and be safe from any possible danger. Stay home, stay safe, help yourself to help the world. I'll see you again. Goodbye.